All right, Kentucky. It is 5 o'clock on Good Friday. Once again, we are together, knowing that we're going to get through this, and we're going to get through it together. So I want you to say it with me. We're going to get through this. We're going to get through this together. One last time. We're going to get through this. We're going to get through this together. James, you have the video of that one other saying it? We'll bring it up here in a minute. We're going to get through this. Now, this is a time and a weekend, a whole week, for multiple faiths that is about faith, that is about knowing that we have faced as people, as Christians, as Jews, as members of many faiths. We have faced very difficult, dark times, and we have prevailed. We know that the weeks or the months ahead are going to be difficult. We know that there are going to be tougher days before there are easier days. But we also know, because we have faith, that we are going to get through this. We're going to get through it together. We are going to pass this test of humanity that has been placed in front of us. We're going to get through this because we're going to follow the 10 rules that we know help us to reduce the spread of the coronavirus and help us to ensure that we protect one another. Those rules are staying healthy at home. The most important rule. You should be at home. And we'll talk in a bit about how all through this weekend, even with it being such a special weekend, you should be at home. That means not getting together with family outside your house. I know that's tough. Use Zoom, use FaceTime, use whatever you can digitally. But just know that we did better last weekend than we did the weekend before, and we need to do better this weekend than the next one. And we'll talk about tough areas, problem areas, our senior living facilities. If we violate these rules this weekend, it increases the chances of even more harm to those who are most vulnerable. So stay healthy at home. Number 2, avoid crowds and gatherings, no exceptions. Pull up at a crowd, a grocery store or hardware store, can't go in it. And we've had to make the tough decision as a people that we won't be able to even get together this weekend or this week for what a special week and weekend. Practice social distancing. This isn't an excuse to say we can do what we want just 6 feet apart. It is, we're healthy at home. We're not going to be around any crowd. And when we come across somebody, we are 6 feet apart from them. Know when to seek care. As our cases escalate, and they are, and as hospitalizations escalate and need for ICU beds, we have to know when not to tax the healthcare system. That means if you are nervous but well, call the hotline. If you are sick but wouldn't have otherwise sought care, call but don't go to your doctor's office. And if you are truly sick, make sure you get care. And if you're truly injured, make sure that you get care. Wash your hands, no cheating, 20 seconds with soap and water every time. And surfaces, you can use that 1-100 bleach. If you can't find disinfectant, apply for benefits. We want to make sure everybody gets through this. That means we need you to be on Medicaid if you're not covered in some other health care coverage. That is going to help the health care providers that are caring for you. We talk about our frontline heroes being the medical profession right now. They need you to be on Medicaid if you're not otherwise covered. And then there is unemployment. We know that we have record numbers of people signing up. Keep going. We will continue to work to increase our capacity. Just yesterday, I believe we set a record in Kentucky by making 71,625 separate payments. That's yesterday alone. For almost $43 million, and that included, it was the first day that included the new $600 extra benefit that was passed by the federal government. If you have not been able to successfully sign up yet, or that's not you, that's us. If we have not been able to get you in the system, We understand that you're anxious. We understand that you're frustrated. We understand during these times it should be a better process. But we're doing the best we can with the largest volume in our history, scaling up. We promise that we will get to you. We will make it right. Prioritize your mental health. For many, this is a spiritual week and weekend. Make sure that you take advantage of it if that's something that you do. You can join if you don't have a service, watch ours virtually at Beargrass Christian Church out of Louisville, which is where I'm a deacon. You're welcome to join us or any other service that's out there. But make sure you're getting your physical exercise and that you're spending time with family, that you're connecting with friends through virtual means. Do not travel anywhere for any reason other than a couple of exceptions. Don't travel. And finally, report noncompliance. This has helped us find, for instance, a couple gyms that even though they absolutely knew they couldn't be open, we're still letting people in so that they could be right around each other exercising, spreading the coronavirus, and we can't be doing that. So we always talk about the 10 rules plus one. Fill out your census. It's not just something that will help us rebuild. This is actually a legal requirement for everybody. You have a legal obligation to fill it out. It's actually against the law not to fill it out. Let's all fill it out, and let's make you competitive. So this is the dashboard about how we are doing to date through yesterday. We are 18th right now. And yes, I believe we're number one of our southern states, but 18th isn't good enough for us. I know that. We've never been excited. Whether you're a Cats or a Card fan or a Hilltoppers fan or Murray or Northern Kentucky University, 18 is not where we want to be. So we need more and more and more folks to do it. And you can even look at some of the counties. These are some of our higher ranking counties, but even some of our best counties are at 50%. We need to do better. We are healthy at home. There is plenty of time to fill out your census. It just takes a small amount of time. Let's get to number one on this list. The other thing that we ask is that you model the type of behavior that we need and that we need so badly. What's been amazing about Kentucky, why we're flattening the curve, is we have seen our duty, we have accepted it, and in many instances you've taken joy, even in what has been sacrifice and difficulty and changing our economy and our lives in ways that we would have never expected. You have risen to the challenge. And by spreading it on social media, by showing people that we can do this, right? We can do it together. That's not me, that's you showing it. I believe that we have had more and more compliance. So let's look at what we've got for today. So this is pretty incredible. This is a firefighter separated from his medically fragile child to offer the maximum protection. Given as a first responder, he can be exposed. This is a type of sacrifice that people are making. So let's honor both this firefighter and his child by not engaging in mass gatherings this weekend or at any other time. If you're considering doing it, think about him and think about that kid. Knowing their sacrifice, it's our duty to make sure that we support them. Mass gatherings do not support them. It spreads the coronavirus. It means it could get to this brave firefighter, or even worse, get to his child. So if you don't believe me, do it for them. These are first responders thanking frontline healthcare workers. Heroes talking to heroes. And as you can see, doing it with social distancing. This is the UK College of Pharmacy doing their work with the new hand sanitizer being made by our bourbon industry. We appreciate them both. All right. These are our healthcare workers. Again, frontline healthcare workers. And look at the amount of PPE that they're wearing. Now, this is how dangerous this virus can be. This is why we engage in social distancing, to better protect them as they come to the front lines. And they are a good example of this week being National Public Health Week. And so, folks, this is our public health our department here in Frankfort, our local public health groups that are out there, everybody that's working on the public health front or in our healthcare system, thank you very much. You absolutely do save lives. I want to thank all of you. I want to personally thank our Department of Public Health here in Frankfort. That what's being asked of them and what's being asked of everybody is the greatest challenge that any of us have ever seen and faced, and they have certainly risen to that occasion. This is a Google meeting, teacher and our first graders, showing that we can still reach out to our classes. We should be engaging our kids intellectually, socially, and let's make sure we use all these opportunities. And thank you to this teacher for making sure that she is still providing that enrichment. The chalk drawings continue, and our artists out there are incredible. Here's some kids honoring what Easter means to them, which they will be practicing at home in the safest way to do it. And I thought that this was pretty interesting. This is one family. This is just one family that are spelling out healthy at home, showing that they as a unit are sticking together, but obviously away from everybody else. And I thought this was pretty creative. And this is the type of modeling that we're talking about, that embraces our social duty, that even celebrates our civic duty, and finds some joy in doing what we can do to rise up and defeat this adversary. What's being asked of us is different than has ever been asked of us, but we can do it. It's about staying home. It's about just staying away from people for a period of months. So what we've been tasked with, we know we can do. We just got to be resilient. And here is houses lit up green to honor those that we've lost. And later we're going to need to light them up green again today and probably most days. Next, we've got another video from pastors. These are all, I believe, Christian pastors. Yesterday we had multiple faiths, and I believe tomorrow we'll have multiple faiths. But coming into this weekend, which is Easter, we also have Passover being celebrated right now. We just were reached out to, especially after yesterday, from even more faith leaders wanting to spread the message that the healthiest place to be is in your home.
Hello, I'm Todd Lester, pastor of Forks of Elkhorn Baptist Church.
This is Dave Hammond, pastor of the Faith Baptist Church of Myra, Kentucky and Pike County.
Hello, I am Ronaldo Henderson, and I am the senior servant of the Washington Street Church of Paducah, Kentucky.
Hi, my name is Chris Michael. I'm the pastor at the First Christian Church, Disciples of Christ in Owensboro, Kentucky.
Hello, Kentucky. I want to encourage everybody to stay healthy at home because every challenge brings with it an opportunity.
Churches might be empty this Easter, but so is the grave.
I want to encourage you to meet together separately this Sunday to remind you that on that first Easter, Jesus came to people behind locked doors. He will come to you as well.
Even though we cannot meet Sunday, that doesn't stop what we celebrate. Up from the grave he arose. We celebrate the victory over death. Every believer has defeated death, absent from the body, present with the Lord. Happy Easter to all of you.
We encourage you and your family to worship the risen Lord at home this Easter Sunday. Stay healthy and stay safe.
So therefore, we ask that you would be creative in your worship and that you would stay safe, stay home, save lives.
So let's seize this opportunity to better see Jesus, and may God bless you and keep you, is my prayer.
We want to thank all of our faith leaders. It's virtually all of our faith leaders who are telling us the same message that where we should be worshiping regardless of our faith is at home this year. Let's make sure that we listen to them. All right, before moving into where we are right now, I want to do something a little bit different today, and I think we're going to be doing it going forward. Virginia and her staff have been really incredible at helping to make sure that everybody, can get the information that they need. And what we've seen from folks, not just those that Virginia is directly serving, is that they want to learn a little bit more about sign language. So each day we're going to have Virginia teach us and teach me a little bit of sign language. So for the first time, we're going to switch places. She's going to come up to the podium and talk us through it, and I'm going to do my best. But I want people to know that I don't know what we are doing today other than the phrase. So I will be learning just like you.
Thank you, Governor. And what you say every day is we, and that's everyone. That includes, that's a circle. That includes everyone. We will get through it. This is a point, and you go right through it together. These are individuals, and they're together, and you will circle it together. So we will get through it together.
One more time.
One more time. We will get through it together.
Thank you. So as we go through this, we'll learn a little bit each and every day so that all of us can better communicate with all of our brothers and sisters here in the Commonwealth. All right, I want to talk a little bit about where we are. James, could you put up the new Kentucky map from our website? So as you've noticed the last couple days, you've been hearing newer counties that weren't necessarily on this map before. Let's remember, this coronavirus is everywhere. Just because there are still just a few counties that are in white here, it is in those counties too. It is here. We are in the midst of our surge and escalating cases. Now is the time that we have to be at our very best. The next couple weeks at least being absolutely critical to us not only blunting or flattening the curve, but really protecting those that are most vulnerable, especially our seniors that are in different types of assisted living facilities. You can see on here what happens. It's not just our counties that have the largest population, but what you see are clusters. Clusters where very quickly it can spread throughout the community. All of us are going to be hit pretty hard. You know, I believe that we are doing better than just about every other state, but this is a very serious virus, and we've got to continue to expect to see more cases, and we will continue to see more deaths. Again, the road's going to get harder before it gets easier, but I know that this map would look a lot different today but for your actions. So let's show the COVID Act now based on strict compliance. This is just a map we show, and these numbers at different times are revised, though there have been some national revisions, and then there have been some really difficult days since the national revisions. These projections, they're all just people's best guesses, right? They take a little bit of data on a virus that they have never seen with some overseas data that may or may not be reliable, and they just try to do their best. That's not criticizing them, but we ought to know that what comes tomorrow, we can guess that, but we will only know when it happens. This is the difference between us being strong this weekend and next weekend, making sure that we don't allow ourselves to stop what has been really good social distancing and really good compliance. I mean, this is just one example that the difference could be up to 11,000 lives. Those are 11,000 Kentuckians. Those are 11,000 people that are loved by their families and their communities. It's absolutely worth fighting for, and it's sure as heck worth staying home for. If all we're asked is to stay at home, 11,000 lives justify every single thing that we are doing. So let's remember there are real stakes, and we're going to talk about those here in a little bit, but there are real stakes. All right, moving to the next. PPE, personal protective equipment. So we talk about all the different things that we use to fight the coronavirus, our social distancing, which we know we're doing a good job of. I'm not going to show those charts today. We have increasing our healthcare capacity, and we have testing. These are the ones, the things that can help us. Social distancing flattens that curve, make sure that we have enough healthcare capacity. Increasing the healthcare capacity gives us room for error to make sure that we have the people and the beds and the equipment to take care of everybody who's going to need it. And then the increased testing not only helps us identify those who need care, but as we want to eventually start loosening restrictions in the future, significant increased capacity for testing is going to be absolutely critical, and every federal statement or prediction relies on significantly more testing than we have right now anywhere in America, including Kentucky. But certainly number 2 and number 3 rely on personal protective equipment. This is what allows those that are taking care of us in hospitals or nursing homes, any other area, and those that are actually doing the tests to be safe in how they are doing it, to reduce the chances that that healthcare worker contracts the coronavirus. And so many of our healthcare workers have. Examples of PPE go from the N95 respirator, which is really important and one of the hardest to get, gowns, which is the protective equipment, and nitrile gloves, along with a lot else. We continue to need your help. We're trying to buy it, we're trying to manufacture it, and we have donations. I will tell you, while we're having more success on the manufacturing, and we have some glimmers of hope on the purchases, that's been the hardest. Your donations have been our number one source for additional PPE. So we're calling on you to do it even more. Look in every possible place, every possible business that's out there. We need especially those respirators, we need the gloves, we need the gowns, we'll take the surgical masks. This is the way to do it. Here's the number, here's the website. You can drop it off at any transportation cabinet area headquarters. You can drop it off at any of our posts for the Kentucky State Police. Please continue this. Every time we get more, it'll allow us to deploy it when it's needed, and it is absolutely needed. So Kentucky, we're counting on you. You have come through. Let's keep doing it, knowing that every time that you donate these, you save lives. Monday, it's our hope to have an update on PPE, on donations we've received, what we have that's able to deploy, and also the system and how we're going to deploy it to different healthcare systems. Our hope is to walk through all of that in detail on Monday. First responders. We are working with our local health departments to make sure that addresses of those that have tested positive or who are in self-quarantine are available just to our first responders when they might be going on a run. That helps them know the level of personal protective equipment they may need. It's something that very reasonable that they ask for, and that we are working to make that a reality. We'd ask otherwise that those individuals' privacies it's their home, it's their address, be respected. But we want to make sure that if something happens there and they need help, that those going also know the situation that they're dealing with. All right, so I'd mentioned that we were going to have some tough news today. Today we have our single largest number of new cases. We have 242 new cases of COVID-19 here in Kentucky. We had one duplicate that we discovered in our system, so our total number of cases, our official number here from the state, is 1,693. We have had 24,288 total tests that we can verify. Those have been all reported to us. We've had 459 Kentuckians ever in the hospital for the coronavirus. We believe it's at least 271 currently in a hospital setting. Since the beginning, we believe we've had at least 177 Kentuckians in the ICU. We believe we have at least 105 Kentuckians currently in the ICU. And we can report, this is really good news, that we have had at least 464 Kentuckians recovered. That's 27%. And when you think about the period of time it takes to recover, because it's not something really short, that is real positive news already. And we believe that number is larger. That's just the number that we can currently confirm. Counties that new cases are in, and it's long, so I'm going to take a sip of water. We have 32 new cases in Jefferson, 20 in Kenton, 15 in Hopkins, 14 in Davis, 10 in Boone, 10 in Campbell, 9 in Christian and Warren, 7 in Muhlenberg, 6 in Marion and Pulaski, 5 in Bullitt, Grant, Hardin, Henderson, and Trigg. And I believe these are Trigg's first cases based on the map. We have 4 in Adair, Boyd, Jessamine, Madison, McCreary, Russell, and Webster. We have 3 in Butler, Callaway, Jackson, Lyon, Mercer, Woodford. 2 in Bracken, Clark, Clinton, Cumberland, Marshall, Oldham, Simpson. And we have 1 in Barron, Caldwell, Edmondson, Graves, Grayson, Laurel, Mason, McCracken, McLean, Montgomery, Morgan, Nelson, Scott, Shelby, Spencer, and Todd. And we have 3 that are unconfirmed at the moment. We also have lost 11 new Kentuckians that we report today. These are 11 individuals that are loved by their families, by their communities. It brings our total death count in Kentucky to 90. It means we've lost 90 amazing Kentuckians, which is a loss to all of us. So for those 90 and for the 11 new, let's light our houses up green, our places of business, institutions. Let's make sure that we have done more. We do more of that tonight and every night moving forward than we have before. Green is a color of compassion and renewal. Compassion for those families, for those individuals, renewable because, at least in my faith, I believe that their body is just a vessel and their soul is leaving it for a better place, something that my faith renews their belief in, I think, every single Holy Week and every single Easter. So for 90 separate Kentuckians, let's commit to do better. I know you're working hard. Let's commit to do better. This number's going to get worse, and there's going to be tougher days than today. But our actions today are going to be seen in about 2 weeks. Let's try to make 2 weeks from now better than today. Our new deaths by county are 39 in Jefferson, 8 in Kenton, 7 in Fayette and Hopkins, 3 in Campbell and Christian, 2 in Boyd, Bullitt, Davis, Lyon, and McCracken, and 1 in Adair, Anderson, Boone, Bourbon, Butler, Callaway, Grant, Madison. I'm sorry, these are the overall, not the new one. That's overall deaths by county. My apologies. The 11 are a 77-year-old male in Butler, a 73-year-old male in Jefferson, 75-year-old female in Meade, 66-year-old male in Jefferson, 75-year-old male in Jefferson, 75-year-old male in McCracken, 73-year-old male in Jefferson, 68-year-old male in Jefferson, 92-year-old male in Jefferson, 80-year-old male in Hopkins, and an 81-year-old male in Davis County. Let's commit to doing everything we can to try to make sure that we reduce this toll by as much as we can every day. Breakdown on race of overall cases that we know. This is with 69% of cases us knowing the racial breakdown. It is 81.72% Caucasian, 11.7% Black or African American, 2.5% Asian, 3.86% multiracial. And then on deaths, we currently are 79.45, and on the information on those that have passed away, we know 72% of those that have passed away of their race. 79.45% white, 19.17% Black or African American, 1.36% Asian. So it's a deadly virus. Even with everything we're doing, even with changing our economy and changing our daily lives, it is a deadly virus. But it would be so much more deadly if you weren't doing what you're doing. And how it is deadly is being spread through people, especially through crowds. And with losing over 90 individuals already, I hope everybody knows that even on a weekend like this, we cannot have in-person gatherings of any type. I want to thank our faith community out there. I think we're down to less than 7 churches because we don't have any synagogues or mosques that are holding in-person services. We are down to about 7 churches statewide. We got a lot of churches in this state. We're down to just about 7 that are thinking about having an in-person service. And we absolutely cannot bring people together in one building like that, because that is how the coronavirus spreads, and that's how people die. And I know we focused a lot on an individual church or a pastor, but it is on every individual. That's what one of our orders is about, not to go to a mass gathering. And it's not just the person that's holding it, but every individual that goes to one of these will spread it to other individuals. And I guess I hear that there are some individuals that say this is my choice about whether I go to something and get the coronavirus. But it's not the next person's choice that you might spread it to, having gone to a gathering, getting it, and then going out, whether it's to work or to a grocery store or somewhere else. So we're having to take a new action that I hoped that we wouldn't. It's that any individual that's going to participate in a mass gathering of any type that we know about this weekend, we are going to record license plates and provide it to local health departments. The local health departments are going to come to your door with an order for you to be quarantined for 14 days. That if you're going to expose yourself to this virus and you make that decision to do it, it's not fair to everybody else out there that you might spread it to. This is just an example of personal responsibility. And we're going to make sure that those that are going get notice that this will happen, that if they're going to participate in the mass gathering, it's 14 days self-quarantined at their home. Somebody makes that decision, okay, but understand that this is the only way that we can ensure that your decision doesn't kill somebody else, that your decision doesn't spread the coronavirus in your county and in your community, that your decision to go to a mass gathering doesn't negate the sacrifice of every other house of worship, 99.99% in this state, that are choosing to do the right thing. Folks, we shouldn't have to do this. What we're asking you to do is not to harm other people. It's to love your neighbor as yourself. We shouldn't have to do this. And losing 90 Kentuckians, having 241, I think, new cases today, ought to convince us how important this is. My son was supposed to get baptized this Sunday. He'd been working on it. He was excited about it. We're excited about it. This is my first child that will be baptized. It's something that I desperately wanted to be at. I would have served communion this weekend. It was it fell in, Easter fell in our weekend of the month. But we know that we are all safer at home. And I think it is not a test of faith in whether you're going to an in-person in-person service. It's a test of faith that you're willing to sacrifice to protect your fellow man, your fellow woman, your fellow Kentuckian, and your fellow American. Let's give an update on a couple of very specific areas that we've been talking about. Let's first go to the Green River Correctional Complex. The new numbers there, we have 3 new cases. All 3 are inmates. We actually expected this number by today to increase a little bit more. This happened, we got these tests back, I believe, after yesterday's press conference. We're going to continue to work to protect people in the Green River Correctional Complex. Some of our steps are up there, and I know they're taking additional steps every day. Let's next go to Western State. We have 3 new cases in Western State. We have 2 new patients and 1 new staff. We have no new deaths at Western State, which is an important number. And I know Secretary Freelander is working directly with them to provide the very best service. There have been some rumors out there. We have not been taking new patients since this outbreak occurred, and doing everything we can with a population that can't simply be in their room, doing the very best we can to protect every individual and every staff member in that facility. All right, let's move to long-term care facilities. And this is our challenge, and this is where the coronavirus is devastating every state and all of our communities. This virus comes for those that are most vulnerable, that are older, that have health conditions, and the facilities that it impacts. We are now spending significant, not just resources, but Dr. Stack is spending the vast majority of his time working directly with these facilities. So we have 37 new cases just since yesterday. Now, part of this is there have been significant new testing. I think 3 to 4 facilities tested their entire staff in the last 24 hours, or those just came in. So 37 new cases, significantly more tests. So we have 37 new residents that have tested positive, 38 new staff, and 2 new deaths. So we have 75 new cases either in or connected to our long-term care facilities. There are now, we believe, 29 Kentucky facilities that have been impacted, though it's a little misleading. There are at least 9, maybe 10 of those where it is a single staff member, or maybe 2, and it doesn't mean that they have even been in or around the facility before they tested positive. We have 3 facilities that have been hit very hard. One in Jefferson we talked about yesterday, one in Adair, and one in Lyon County. We've had our first 4 volunteers down in Lyon County, and they have been really welcomed by that community. James, can you put up the, when they arrived, this was waiting for them in the courthouse there in Lyon County, welcoming them. They are already working really hard. What we hear back from the staff is they have brought a new energy and an ability to care. We're working with not only a number of these facilities to set up their own COVID wing, knowing how this is infiltrating facilities, and knowing that for those that don't need a hospital immediately, if they can still be in their facility, because these folks can be fragile for transport too, that can be sometimes the best outcome. We have multiple facilities across the state setting that up. We're also working with multiple hospitals right now to have specific areas where, if for lack of a better term, we have to make a rescue and transport, that they are ready to treat those patients. We're also planning right now on using the fairgrounds, which we have stepped up our capacity as an emergency landing place, especially for nursing home patients. We have also created a long-term care task force that I'm going to ask Secretary Freelander to talk about.
So the governor did a very good job of describing the complexities that face folks in long-term care, face folks who are doing transportation, face families, face residents, face staff, trying to balance a variety of needs, the importance of transportation, the trauma that comes with transportation, how facilities remain fully staffed when staff start to test positive. These are all things that we have to balance and look at and try to figure out in a changing environment, in a very challenging environment. These are some of the most vulnerable residents in some very, very precarious health situations that we need to take the most care as we work with them, and we work with the facilities, and we work with the hospitals to make sure that we're providing the very best care and recommendations that we can come up with. You heard Dr. Stack yesterday talk about his team and how his team engaged with a specific facility, but that team engages with every facility that has someone who tests positive. So this fast-moving situation, all of these different things that we have to balance, we've asked a very small group of individuals, 10 individuals, most of them physicians, to come and help us think through the best way to balance all these different things and to make sure that we're protecting our loved ones. So, physicians from the University of Louisville, the University of Kentucky, Bellarmine professors, as well as psychiatrists, medical ethicists, geneticists, and geriatrics. We have brought this group together to help advise the cabinet, to advise Dr. Stack, to advise the cabinet, to advise all these facilities about how to balance all these various things and various pieces that they must. We had our very first meeting today. It was a Zoom meeting, to be clear. It was a very good meeting where we brought up lots of issues because these folks all have experience in long-term care. They've been either medical directors, hospital infection control leaders. So these folks all come together and are giving us their advice on when to transfer, how to transfer, looking at facility layouts to make sure that we can provide some isolation in a facility, or if we can't, or if a facility's staffing has gotten to the point where they can't continue, either how do we provide more staff or how do we move residents out to maintain and protect them. So I want to thank these folks. They came together very quickly, and they're bringing their expertise not only from what they have across the country, but also Kentucky. We actually have national experts here, and we are using them to advise us. So I want you all to know that we're doing our very best for those we're all trying to serve. Thank you.
Caring for those in these facilities and responding to them also led us to activate our first state park in this effort. We anticipate that we will see more of our lodges activated, whether it's for the caregivers or volunteers we're sending in, or potentially for residents themselves if they are not in need of hospitalization but can't be isolated within their own facility. Finally, let me just mention, and then we'll open it up for questions, that I know all across the Commonwealth people are still sacrificing and recognizing that. So I'm showing 2 T-shirts today. This one's from Moorhead, and this is their Main Street, which has been, for the most part, closed for so many of those businesses. But what they're saying with their statement is they're staying strong. They know we got to beat this, and I know every community out there understands and is in it with us. All right, we have 4 reporters with us here today. We have Joe Sonka. Joe, give me your last name so I say it right.
Ragusa.
That's what I thought.
Yeah,
Joe Ragusa. Okay, but you looked at me funny when I pronounced it the last time.
I wasn't expecting to be called out.
All right, Daniel DeRocher. And Mike Valente. And then I have just a couple of questions here. So we will go back and forth. Joe, I made you go last time. Why don't you start first this time?
Okay, I have a question following up on the taking of license plates of people who go to mass gatherings this weekend. Does that include drive-in church services that some
No.
are planning? And two, what authorities are going to be taking?
So the question is on the steps that we are taking if people go to a mass gathering, a service this weekend, knowing that they could get and spread the virus to people who aren't there. It applies only to in-service. At least our actions are only in. It does not apply our actions to drive up or through. I guess it's a drive up service. Those provided that a local leader hasn't made a different decision, and it could be based on the density of their county or in Hopkins County based on their outbreak. Our guidance is as long as you can follow the rules, that it's a way to make sure that we aren't having the in-church service. Remember those rules. Cars have to be 6 feet apart. Only a family that lives together can be in a car. You can't put multiple groups in a car. And you can't pass anything in and out of a car, and I know that's tough with communion. So what I'd ask of these churches is let people know what they need ahead of time. And whether that's them going to the grocery store to get it, let them know what they need ahead of time so they can have it there in their car. We're going to have state police there collecting those license plates because the occupants of those cars are in violation of the orders. And then the names and addresses will be provided to a local health department, which are already in just a few areas. I mean, we're talking about 7 at most. I imagine it'll be down to 3 or 4 by tomorrow, but to make sure that those people that have made that decision, and they're making the decision knowing they can spread the virus, are going to self-quarantine, and our expectation would be everybody would voluntarily do it, but they're certainly going to have to do it. I've had 4 calls from residents who live in Whispering Hills Trailer Park in Louisville, hardworking people who barely get by in normal times. They want the governor to know they've been charged a $100 late fee for not paying their rent and have been threatened with eviction. Now, we're going to provide this information to our labor cabinet. You cannot be evicted during this time, and landlords trying to charge you extra dollars for late rent is not right. Yes, you're going to have to owe that rent, but yes, they ought to work with you over the long haul to make sure that there is a payment plan out there. But don't let anybody threaten you with eviction. It's illegal in Kentucky right now. And we need people to be better and kinder and more compassionate for us to get through this. Everybody's hurting. I know that landlord might want their rent, and I know every resident wishes they could pay it, but look at what we're facing. So let's all remember that we are each other's brother and sister, and getting through it together means acting like it. Daniel.
So follow up on his follow-up. Is that order only applying to church services? Because there have been
No.
reports of gatherings for all sorts of things.
It's a good question on whether our actions on mass gatherings will just apply to church services, and that answer is no. It has to be a gathering that we know about, or one that our folks are or are present at. But no, this is by no means intending to single out churches. It's making sure that we're not having any type of mass gathering. And by and large, our faith community has been some of the best at encouraging the right actions.
My actual question, I wanted to ask that. If you look at just our death rate among confirmed cases, that's been hovering around 5%, which is higher than what we're seeing nationally in other states. Is there a reason for that? Why would that be?
So the question is, our death rate as compared to our positive cases seems to be higher than the rest of the country. And I know one explanation for it. I don't know how much it would lessen it, is that we are truly testing the very sickest right now, is that we have had to be very judicious about the tests that we've had. And we've made sure that those who are symptomatic and those who are most vulnerable, and there have been some who've been symptomatic that are in that healthier area, that we've asked to write it out oftentimes without a test. And that's been, I think, a heroic act that frees up a test for somebody else. But it's definitely how we've tested that contributes to that. Now, we will see as we have more testing if that is the only reason. But we in Kentucky are not as healthy as we need to be. When you look at who this virus kills, not just harms. It's not only those over 60, it's those that have heart, lung, and kidney disease or compromised immune system. We have one of the highest rates of diabetes and heart disease and lung cancer in the country. This is a virus that preys on our population in many ways. So our goal is to do everything we can to flatten that curve, especially with the more at-risk population. That becomes even more important. But as we come out of this, and we learn a lot, we learn how to respond to a global pandemic. We learn that we need to have stockpiles of PPE and other necessary equipment. We also learn that we have to get healthier, that it's not just in our daily lives, but when we face something like this, not being healthier can be pretty deadly. Mike?
So this order, as you said, does not apply to the drive-in services. With that in mind, would you encourage Mayor Greg Fisher and other mayors who have prohibited the drive-in services or considering banning these services to reconsider if people can follow the social distancing guidelines?
The question is, given the actions that we're going to be taking as a state don't apply to drive-up services, would I encourage, I know of two local leaders that are prohibiting those from changing their mind. No. They are responsible for their people just like I am. And I have got to give them the latitude to do what they believe. And they both truly believe, County Judge in Hopkins and the Mayor of Louisville, that this is necessary. And the reasons that they give for it are understandable. I mean, the Jefferson County is so much more dense than everywhere else in the state. And then in Hopkins County, oh my goodness, the loss that they've seen, you can absolutely understand the steps that they are trying to take. Now, those that are doing it, please do it responsibly. What we've seen in some other instances is a couple of actors ruin it for everybody else. We don't want that to happen. Police in Pulaski County say they've had numerous cases where one parent lives in Kentucky and the other lives in Ohio or Tennessee, and they're wanting to know how to handle exchanges with the children. So this is one exception to the travel ban. It doesn't say it explicitly, but it says a court order. Court orders include visitation, and so you can absolutely take your kids across state lines to be with their other parent, but you got to come straight home, and for that you don't have to quarantine, but you can't do anything else when you're down there other than make that transfer. And it's really important in times like this, in these situations where there's joint custody, and sometimes there's good relationships between the two individuals. A lot of times there aren't, and we all know the reasons why. But this is a time to work even harder. Your kids are already under stress. For those situations, and this was a question I was asked yesterday, where one of the houses is not complying with the things that are needed to keep people safe, you need to file something with the court on your visitation. I know that they will be very sensitive to it right now. That's the legal process for addressing visitation. So if you are a parent that is not taking this as seriously, and I hope there aren't many out there, you really don't want a filing right now in a global pandemic on the custody status. You don't want that. So let's make sure that we are doing the right things. Joe.
My question is actually about the budget. I believe the deadline to do anything on it is Saturday or Sunday.
Monday.
Monday. So with that in mind, do you plan on signing it?
So the question is the budget. The last date for me to take action is Monday afternoon, and do I plan on signing it? Governor in the Commonwealth of Kentucky has a line item veto when it comes to the budget, so it's not just signing it or vetoing it. So yes, I will sign some version of the budget. We will have some line item vetoes. Now, as we've been looking through them, virtually all of them are about flexibility. We are living in a different time where I've got to be able to move resources as quickly as they are required for where the latest outbreak in this coronavirus is going to go next. And none of us even nationally, knowing what the downslope will look like once somebody has reached the peak. And so my goal is not to eliminate any specific appropriation where the legislature wants to send funding to, but making sure I can do what it takes to get us through this. I mean, they just passed a one-year budget. And so I hope that they are for maximum flexibility so that we can keep our people alive, so that we can reduce the costs to our Kentuckians that this virus brings. Okay, this is an individual whose son-in-law is stationed at Fort Campbell. Their housing came through and we're supposed to move them to the base. It won't be a problem to travel to the base, will it? It's essential. The answer is no. That is that individual's work, which is also an exception. But go and then come directly back, and that should not bring together families that aren't otherwise living together at the moment. I know these are challenging questions, but I appreciate you asking, because when you ask a question this specific, it means you're really trying to do the right thing. We need more of that. So thank you to a concerned parent of a service member. Thank you for your son-in-law's service. And thank you for all of you, because you're all a part of that when one member of the family is. Joe.
Senator McConnell and Attorney General Cameron have both said that Fisher's ban on drive-in church services would infringe on religious rights. Can you respond to that argument against what Fisher's proposing in Louisville?
So the question is, Senator McConnell and Attorney General Cameron have disagreed with Mayor Fisher's position on drive-up church services, and they believe it infringes perhaps on constitutional rights. We're all just trying to make the very best decisions we can for our people during this. Mayor Fisher has to, like I do every day, announce the new cases and the new deaths, and I know what that feels like. It's the hardest thing that I have ever done by far. By far. It's probably the thing I was most unprepared for as governor. And one of the reasons I do it here every day is I don't want somebody else have to do what I'm doing. So I know how he feels. And going through that every day, if that's what he feels is necessary for his city, I'm not going to argue against it. I think it's him trying to do the best that he can. I get why people want to do it. Understand the arguments that can be passed back and forth, but I'm not going to criticize the mayor for doing everything he can to protect his people. Daniel.
So you're talking about people, but then also businesses, right? There have been lots of calls and reports about businesses
Right.
being not accurate. One of those is auto dealers. Apparently there are some auto dealers still doing test drives. Do you have a reaction to that? And do you plan to kind of release the list of all these businesses who are trying to get around the order saying non-essential businesses?
So the question is about businesses that may be violating the orders about non-essential businesses and what should be going on. Specific comment about potentially some auto dealers still doing test drives. Auto dealers should not be having any face-to-face contact with people. They can still operate if it is online or over the phone, but people shouldn't be shown around the lots. And I will tell you, that may be very unpopular with auto dealers that I know, and I feel for them. I mean, the way their inventory works and the damage that this is doing to them, I know it's doing the same damage to record unemployed folks in Kentucky and small businesses that are out there. So I know that we have released a list of at least some companies. We'll see those others as they come out. Certainly if we have placed closure orders on them, those ought to be public documents, and we'll release them under that Open Records Act. Again, these are steps that we shouldn't have to take. And I think I said that a couple gyms were cited. I think that's my error in nomenclature and words. I believe a closure order was entered against them. If it was up to me, I would have cited them too, because they knew they shouldn't have been doing that. And a gym especially, where everybody touches everything. And you know when you're in a gym, nobody actually disinfects the equipment as much as they should. That just never happens. So it's just important that everybody buy in, and that you don't think that you should be the exception. Our labor cabinet, like our education cabinet on unemployment, is doing things and having a volume that we had never, ever previously anticipated. Mike, you have one more?
Congress may include hazard pay in its next coronavirus relief bill. If that doesn't materialize, would you consider stepping in, implementing hazard pay for healthcare workers and even maybe grocery workers in Kentucky?
The question's on hazard pay and Congress potentially including it in their next, we'll call it a stimulus bill or next coronavirus bill. And if they don't do it, would we consider doing it for frontline workers, maybe even grocery workers? First, I hope they do include it. I hope they do provide more stimulus. By the way, they absolutely need to provide it to state and local budgets, because if they don't do that, what this responding to this crisis is going to do to the Commonwealth of Kentucky's budget and every city and county's budget is going to be devastating, which will require additional layoffs, most likely, programs that we can't fund. It'll further harm the economy. Virtually every time we've been through something like this, even the Great Recession, which is very different now. This is much more comparable to the way the economy changed in World War II. There's been direct assistance to those units. That's really important. I'm going to use the CARES Act money to help as many people as I can. So that's one good idea if we can provide hazard pay through it. It comes with a whole lot of restrictions. And we're supposed to get guidance, I think, on the 24th of this month at the latest. It may be a little earlier than that. I will tell you that guidance is going to make a world of difference. Even the question about whether this is dollars that are advanced or dollars that are reimbursed. And just think about the difference in that. I mean, there's no way I can front $1.5 billion to be reimbursed. But if it's advanced, then we can do a whole lot of good, hopefully help a whole lot of people that have been harmed through this, have more resources than ever before to try to increase our testing capacity. And let me, before I take the last question, just mention that. So I was asked a little bit about what I might see as we come out of this. And we are not, as you saw in a new number today, we're not at our peak. And I don't think we will be in the next week. And I think there's a lot of optimism out there, and I like that. I like that we all want to defeat this. But we do have to be resilient for as long as it takes. But one of the only ways that you're able to start easing restrictions on the way down, and everything that the federal government's talking about in that, requires a capacity for testing that doesn't exist in the United States anywhere at the moment. And so easing restrictions is going to require us, and we're going to need to use these dollars, and our national labs are going to have to catch up to have the capacity to test a whole lot of people that we aren't right now. And that's when we're able to isolate them and contact trace. That's going to require significant amounts of hiring at the local level and at the state level. So, you could see, if we were able to get the testing capacity, us having 1,000 people at the state level doing just this, and that would help us to ultimately ease those restrictions. So on top of everything else I talked about yesterday, it's really important to know that we're going to have to invest in that testing capacity, and it has to exist as we're coming out of it. Joe.
The order regarding the collection of license plate numbers and the orders of quarantines, I know it's directed about mass gatherings this weekend, but will it extend beyond this weekend? Is this going to be a long-standing policy as the pandemic continues?
The question is on the steps we're going to take this weekend, identifying those at mass gatherings and asking them, requiring them to self-quarantine for 14 days, so their decision can't spread the virus to another individual, who could spread the virus to another individual, who could spread the virus to more individuals, and so that one person's decision can't cause the death of another person. The question is, does it apply just for this weekend, or will it go forward? I want to see the impact that it can have. It's a step I don't want to take, but I also wanted people to do the right thing. My hope is always that encouragement and positive social peer pressure, positive examples that we see out there, my hope is that will always be more powerful. And look at what we're down to. We're down to a handful, just a handful. And so I know that probably the headline that will come out of this is the actions we're going to have to take on a handful of gatherings. But I want to say that I think the real reality here is everybody, virtually everybody, doing the right thing. So we are now over time. Let me just say I'm proud of you, but the stakes are high. 240 plus new cases, 11 new deaths, and we're going to have some tough days ahead of us. Be strong, be resilient. We will get through it. We'll get through it together. Ring your bells tomorrow at 10 a.m., light your homes up green, and we're going to end today with some videos of all the bells that have been playing all across Kentucky to recognize the 90 individuals we've now lost. Remember, we're Team Kentucky. We've risen up as a people to defeat every challenge before us. And even when we have tough days like today, we know we get up tomorrow, we do the right things, and we'll defeat it. Again, it's Good Friday, a special day for so many people. While I'll be back tomorrow, and I'm going to be back on Easter too. I hope everybody has a good Holy Week, a good Passover. Thank you to everybody out there who's doing it right. God bless.